Yeah, you just, everyone is muted. So they don't need to mute themselves. I think everyone is muted.
Someone came to say hello.
Aw. So cute.
Right. Although he got into a big mess this morning in the backyard, he started to dig a hole. I got very upset. Okay. All right, let's see.
Maybe we'll just start the recording then.
Yeah, I could do it.
Well, because oh, you're already being recorded. Okay, so you're on recording, and then where's the Facebook Live? Oh no, I think Victoria has the host control now. She has to do the Facebook Live.
Vic, I don't know if you heard Peter, but if you have, since you're the host, you have control of pressing the button at the bottom for Facebook Live.
Okay. Great. Let's see. No, they don't like this. Let me see something. I don't. Facebook Live. Remote control. Would it be under remote control?
I'm sorry, sweetie.
Is it under remote control?
Is it under remote control?
It should have the button that says more at the bottom.
At the very bottom, it says more.
Okay.
And it should say,
I see. Live on Facebook. Okay. Yeah, I have it. Mine's at the top. That's what it is. I'm going to click it on now.
Okay.
Why is it? I don't know if it's.
Yes, darling, I love you. I know. We had a rough morning together, right? We had a rough morning.
Guys, 12:30.
All right. Okay, Vicky, are we all set? It's 12:30.
The screen is paused.
The screen. Hear both of you.
All right, I just want to check if everyone who's joining us today can see us and see the screen and can hear us.
They could send a note in the chat.
If you can't, just send a note in the chat for the Q&A, and then I will be able to help you guys out. Everyone seems so far, yes, all is good. Great.
All right.
Great, awesome. Well, thank you, everyone. All right, I'm going to do a little quick introduction, and so just bear with me a second. So all right, so we're gonna get started now. So it's about 12:31 on Wednesday, the 21st, just so we have a nice check of where we're at and what day it is. I just want to thank everyone so much for joining us today. We're excited to have you. And I'm really thrilled to do this particular topic with Dr. Vicky because we feel like it's so important. And I know, you know, with women and our health and the hormones, everything is always very up and down. And I feel like, you know, with all the stress that's going on, this is a really timely topic. And so I'm thrilled and honored to introduce Dr. Victoria Liotta, who is a doctor of acupuncture and a New York State licensed massage therapist. In addition, Victoria holds a BA from Villanova University prior to earning her doctorate in acupuncture from Pacific College of Chinese Medicine. Dr. Liotta's goal as a healthcare practitioner has been to utilize her knowledge to help those with challenging health conditions. And her philosophy is simple: take care of yourself now, which is very, very true. And with the COVID, we definitely know that's a real statement. Through years of study and experience, she has developed an approach focusing on concerns, comfort, and improved health of each of her patients. Both being an acupuncturist and massage therapist, she often helps people who are experiencing pain. Victoria also aids those who are in need of care after receiving chemotherapy or radiation. In addition, Dr. Liotta has experience in the specialties of psychological and emotional health and frequently treats people who have anxiety and depression. So again, I just want to thank Dr. Liotta for joining us. It's a thrill and honor. And Vicki, I'll let you take it away.
Okay, well, thank you, Dr. Pina. And I just want to mention, many of you may have seen Dr. Pina on Dr. Oz or News 12. She is a wonderful source of information, especially for women's health. And she does have a book called The Little Book of Healthy Beauty, which is a wonderful book with so many tips and information on health and beauty for women. It's a very good book to look into.
Thanks, Vicki.
You're very welcome. Okay, so there we are, Dr. Pina and myself, and we're going to talk about women's health today. And women's health, my goodness, it's such a broad topic. When we discussed doing this topic, I was a little bit overwhelmed because it covers so much. When you think of women's health, of course, you think of gynecology, but you also think of other things that women are prone to more so than men, like anxiety and depression, even insomnia, autoimmune diseases such as lupus and Sjogren's disease. So women's health really covers a lot, but there are three, I would say, not so much stages or categories of women's health, which we're going to focus on today. But feel free to ask other questions if you do have them at the end. We'll be taking questions more so at the end. But the three categories that we're going to focus on today are, menses, fertility, and menopause. Okay, so with the menses, the average age is for young women to start their period is around 12. I believe I read 12.5. It might even be earlier these days. You hear of a lot of young ladies or even children, I have to say, in elementary school, starting their period as young as, I don't even know, 8 maybe, and that would be considered a precocious puberty.
Yeah, it's very early these days. I do think it's because of all these extra hormones in our environment that's, allowing the start of menses to become earlier. So it's definitely, I think, a problem, but you're right.
Mm-hmm. Absolutely. And I was going to mention even the xenoestrogens, which are, they imitate estrogens, and they're found a lot in plastics, even in shampoo. So we're seeing, for that reason, not just the hormones that people are getting or children are getting through their food, but also through these other substances and chemicals that are out there. So with menses, start about 12, and as we know, there's many issues that could go on with that. It could be a long period, painful period, different things that we're going to talk about today. Fertility, that's basically reproduction, and there are things associated with that, either infertility or you do things of miscarriage, so many things with fertility, and also menopause. You get to a certain age, you think I'm all done with that, and then you have another whole host of symptoms that can occur. It was funny, I was thinking, I said, Mother Nature isn't always kind when it comes to these things, and sometimes I wonder, well, is she really a woman? Just a little joke there. But with menopause, that's usually about 50 or so, but we'll talk more about that. Okay, some common women's health symptoms and conditions. I just want to, mention these. Maybe it'll give you some ideas from some questions later, and I am going to touch upon each one of these. So PMS, of course, we know of as premenstrual syndrome, dysmenorrhea, basically menstrual cramps or pain during the period or before the period. PCOS, you might not have heard about it unless you're a healthcare practitioner or have it yourself. It's polycystic ovary syndrome. And infertility, which many things could cause infertility. We just talked about that. I just mentioned it briefly. And menopausal symptoms, as I said. So let's kind of delve in. And the first topic I want to talk to all of you about is premenstrual syndrome, or PMS. I started with this because this is pretty much the starting point. When a young lady gets her period, this would probably be one of the first symptoms she may get if she does have problems with her period. The phrase was coined in 1953, although I'm sure it was around way before that. The Chinese ancient texts talk about, irritability with the period and other symptoms as we approach our period. And it really, the term grew out of the other term called premenstrual tension syndrome, which was more related to the emotional issues that women would have before their period, such as irritability, mood swings. And then PMS really, from what I remember, became the term really became popular probably in the early 80s or so. I think there was maybe, I hate to say, a case where a woman went berserk, for lack of a better term, and there was a legal issue, and they said, well, it was due to PMS. And I know among me and my friends at the time, we were always saying, oh, she's PMSing. We still use that term today. I'm going to put my glasses on for a moment just so I can see a little better. So, this has been around for probably since the dawn of time, but the phrase was coined in 1953. And I'm sure that we all are familiar with the symptoms: irritability, headaches, menstrual cramping, breast tenderness, bloating, acne. You could probably put some more in the chat box if you're wanting to. And it's a physical and psychological symptom between ovulation and the beginning of the period. So basically, you ovulate, that's mid-cycle. And then if there's no pregnancy or no conception, then the period will start. You start moving towards the period, and as you get closer to the period, there will be a drop in estrogen and progesterone, and that can cause pain, especially before the period. One thing I wanted to mention: there's another condition which is much more severe than PMS, and I have seen a few patients with this condition. It's called PMDD, and it's premenstrual dysphoria disorder. Dysphoria has to do with the mood, usually means sadness or being ill at ease. And the symptoms are similar to PMS, but they're much more severe. And they include psychological issues such as, or conditions such as panic attacks, sometimes frequent crying, more extreme moodiness, and difficult sleep. It's pretty much, a patient actually described this to me as, it's like PMS on steroids, and very true. And it is due to steroids, fluctuation in gonadal steroids, which are sex hormones, and disrupts the serotonin levels. Serotonin levels are important to keep us at an even keel. They're involved with mood, and you've probably heard of them through SSRIs. Many people take SSRIs with this condition. Serotonin, selective serotonin reuptake inhibitors, or what the SSRI is. I'm not going to get all into that, but it basically controls the level of serotonin from dropping, and it helps with the mood in this case. And right now, PMDD is still classified as a psychiatric disorder, but I think it's probably more due to hormones. Do you know anything about that that you could add, Pina, about the PMS on the Western or the naturopathic?
Yeah, definitely. I mean, when it comes to the time of the menstrual cycle, I think what most women don't realize, not only do we cycle monthly, but we cycle daily as well. And when we have, the underlying hormonal imbalances that Dr. Vicky will get into in a moment, the biggest frustration of why women come into our practice is because they would say that either half of the month or most of the month, they don't feel good. And whether it is to something where they are getting chronic headaches, or they just feel more bloated, or maybe more, irritable. But sometimes, Vicky's right, where PMS becomes a more significant emotional issue, where they can get more severe panic attacks, or become more severely depressed. And so, unfortunately, from my standpoint, like Vicky said, PMDD is considered a psychiatric issue, but it's really not. And, as we delve more into the underlying imbalances, you'll see that whether it's PMS or PMSDD, from a natural medicine standpoint, there are these underlying imbalances that can be treated. So whether, I think the problem is that when people go to their conventional doctor, they're just put in this box, and they're like, well, this is it, and you can't be healed, or things can't be fixed, and you need these drugs, or it is a psychiatric problem. But when you really look at these underlying causes, I find it quite refreshing, and women find it quite refreshing about how much better they'll feel when they regulate the system.
Mm-hmm. Great. Thank you, Dr. Pina. And along with PMS, you can have dysmenorrhea, which is painful periods or menstrual cramping. Most often before, before the period starts, or you could have, pain during the period, which is, I believe, more troublesome. Basically, it's caused by prostaglandins triggering uterine contractions. So as the uterus contracts, you may feel pain or discomfort.
Right. Sorry, go ahead.
Of course, because I was going to say is stress. I don't know if you're going to mention that, but I'm sorry, Pina.
No, go ahead.
Okay, yeah, the stress is a big cause of painful periods. And I'm going to get to the Chinese medicine side of that in a moment. Stress, I always tell my patients, causes so many different things to happen in the body. Okay, so it affects the digestive system. The digestive system actually slows down with stress. I'm just talking generally now, not about women's health. When you're stressed, I don't know how many of you suddenly you might get a little diarrhea. I hate to say. With stress, the heart rate goes up, so you might get palpitations, or higher blood pressure. So many different things can happen, and it can affect your cycle too. So more likely, if you're stressed, you're going to have painful periods and PMS, and even other symptoms. Did you gonna say something? I'm sorry.
Yeah, no, I mean, and along with that, I think, what I find a lot with my younger women who come into the practice, you see dysmenorrhea, usually someone, whether 18 or their college years, or, I mean, again, sometimes continue on. When I started my period very late, but I had awful dysmenorrhea, and besides you being 100% correct, not realizing, me being a type A type of person, the stress I put on myself did create more prostaglandins, which triggers more inflammation in our system. But also too, what's also is an interesting note with painful menses is actually where the uterus sits. So what most women don't realize is that the uterus, is literally hung in the center of us by ligaments, kind of like a puppet. And so when those ligaments are either pulled or tightened one way, the uterus can tilt either forward, or it can tilt and lean backwards. And when the uterus itself is also tilted, what happens is that when it's time for your uterine lining to shed and start your period, instead of you being in neutral and allowing the blood to come out, when you're tilted, the blood, what happens is it winds up accumulating. So what happens is that the uterus doesn't want that extra blood in the uterus because it's an irritant. And that's where you get the increase in spasm, because the uterus is actually trying to expel the blood that's in there. So a lot of times you find with women that once really their flow starts coming, they do feel a lot better. And that's something at the very end, we could talk about some stretches and some exercises that I think women should be doing anyway, along with the stress management. I think it'll be help. Someone mentioned in the chat that Mayan uterine massage therapy is also phenomenal. I actually used to get that done as well. And we could probably make some recommendations. I'm sure there's some practitioners in the area that also do this type of maneuvering that allows the uterus itself to come back into neutral, which is very, very helpful as a manual type of therapy, along with acupuncture and everything else. So, sorry.
No, that's very, very good. Excellent information. That's something that I've never heard of, that type of massage. I'm going to have to look into it and see if there's any practitioners out there that I could refer people to, because it's not something that I was trained in at this point. So, thank you very much for that information. Dysmenorrhea can also be caused by other conditions, endometriosis, which women are prone to fibroids in that case, and also pelvic inflammatory disease. But there's hope. And there are treatments out there, or things that we can recommend. You know, Pina just gave a good recommendation about the, I think it was the Mayan massage. So with either PMS or dysmenorrhea, I'm going to talk a little bit. I'm going to jump over to some Chinese medicine terminology. Okay, some of you who have been to earlier webinars might have heard me talk about qi and blood stagnation. Okay, so this is just one pattern in Chinese medicine that I'm going to talk about. There could be other patterns which are giving someone, you know, a painful period or PMS, but the main pattern usually is, or there's always some kind of involvement with qi and blood stagnation, and specifically the liver, associated with the liver. Now, it doesn't mean that you have a bad liver or a fatty liver or cirrhosis. It's the energy of the liver, because the liver stores the blood in Chinese medicine and acupuncture, and it also it moves the qi in all directions. And when qi is moving well and when blood is flowing well, there's no pain. I always say the old Chinese adage is, where there's stagnation, there's pain. Where there's no stagnation, there's no pain. Okay, so if the qi and blood are flowing properly, probably no pain. And this goes back to what Dr. Pina was saying about the uterus being, you know, tilted and the blood accumulating and not flowing properly, you know, during the period, getting stuck almost. And a lot of times, that's why we ask women when they come into the office about their the quality of their period, their blood, the blood of their period. We say, do you have any clots? And you're probably wondering, well, why would you ask that? Clots are an indication of stagnant blood. Okay, so that's why we ask that question. We also ask about the color, the length of the period. It gives us clues of how to treat what's going on in the body first of all, and then how to treat you properly. But in this case, with the PMS, it's usually there's some kind of stagnation going on between the qi and, of course, the blood. Okay, these are just some recommendations to reduce salt. I say that because salt tends to bloat us. A lot of times we have bloating with PMS, and also sugar intake. You always want to reduce that. Reduce caffeine, because that can stagnate both the qi and the blood. And as Pina said, you know, it's good to have some moderate exercise every day, or at least a few times a week. You know, get up doing some stretches is great. Are great. You know, along with yoga. I think it's the Pina. You familiar? Is it the cat pose posture that you
Yes.
recommend? The cat. Okay. So those of you who do yoga, you probably know of the cat posture. And also there's acupuncture and Chinese herbs. I'm going to go through a few points. I'm not going to do acupuncture, but I'm going to show you how you could do some acupressure on yourself. And there's some great Chinese herbal formulas and single herbs that are good for PMS. Dongguai is always Dongui is always in the formulas. That's a very good herb. I wouldn't recommend running out and buying these herbs yourself before talking to a practitioner, though, because there might be some contraindications or things that don't blend well with, you know, other things that might be going on in your body, either medications you're taking or just in general. But naturopathic remedies. Pina is a great source for that, and I want to see if you could add something to what I'm saying, just in general.
Yeah, I mean, you know, obviously, you know, when it comes, you know, when, you know, in our practice, whether it's myself or Dr. Vicky, we're looking at, you know, all aspects of what's causing the underlying dysfunction, you know, and so when we're able to, you know, sit with you and figure out, you know, is it more structural for you, like doing the yoga poses or doing the manual therapy, or is it, you know, more where we could do things through botanicals or acupuncture? I do find, you know, it really targets the person and their condition more specifically. So that's always our approach with any of these, you know, hormonal imbalances for that matter. But furthermore, you know, with PMS and dysmenorrhea, I mean, in particular, like I said, I had a lot of experience with dysmenorrhea, and besides, you know, for me, it really was, you know, acupuncture that did save my life. And probably one of my, besides doing the stress reduction, I also, at that time, I took extra magnesium is very helpful to help with spasming and cramping. There's an herb called viburnum also known as cramp bark, literally. So viburnum is super potent and very effective. It tastes terrible, I will tell you that. But it is very, very effective when it comes to painful menses and cramping, and especially if you don't want to be taking like an Advil or a Motrin all the time. And then with regards to, PMS itself, again, looking at the timing of the PMS, and usually there's some beautiful herbs like Vicky said, like Dong Quai or Vitex. I'll talk a lot, which also is known as chase tree berry, because sometimes the PMS, when you have that higher stress with that's causing whether the PMS or the dysmenorrhea, you get, when your stress is high, it increases your stress hormone of cortisol, and cortisol naturally eats away at progesterone. And so now you're going to have this, what's seemingly this false elevation of estrogen, and kind of giving you like an estrogen dominant picture. And so Vitex is a great plant, also known as chase tree berry, that helps re-elevate the progesterone levels, so you're not having that strong estrogen picture, which is more of that, irritable, painful, bloated type of feeling. So like I said, there's some beautiful formulas out there that we use in our practice, one actually called PMS Support, that has the Vitex and Dong Quai and some other botanicals.
Yes, and it's good. I find that, and it's true, that herbs work well when they're blended together, not just a single herb. Too.
Right.
So people say, like, well, what herb's in it? And I say, well, there's a reason that these herbs are put together. They work with each other and bring out different qualities.
Right, because that's a whole lecture talking about the synergistic effect of botanicals, because that's one thing that, I had 5 years of training in botanical medicine, and it's not just about, of course you can use herbs in a single way, but again, when you're able to, combine the plants in a certain way, it creates the balance, because that's how a woman's body is. It's not just one thing in one way. It's like these underlying nuances that you want to, support the body. So, that's one of the reasons that excites me about natural medicine. It's kind of like this alchemy and figuring out, what does a person need. And thankfully there are, some nutraceutical or herbal companies that have known through hundreds of years of, studying botanical medicine, that they put these plants together for a very specific purpose, and they work.
Mm-hmm. And yes, and that's great information, Pina. I just want to, thank you again. You're so well versed in 5 years of botanicals. That's a lot of good studying.
Not in Chinese herbs. That's different, though. They're all Western herbs, which is different.
And you have that right at your fingertips, which is great. And like we were saying, with the combinations, at least with Chinese medicine, I'm sure botanicals too, certain herbs draw out, herbs are used for different things. It's not just, for, let's say, women's health or blood stagnation, like we're talking about here. But, one herb has many different functions. And if you combine with another herb, it'll draw out its function that's needed for a specific condition. So
right.
That's basically, I think, with what Pina was saying too. But let's move on and talk about some acupressure. Okay. Before we get started, I just want to give a little background on acupressure. It's based on acupuncture points. So if you look at these pictures, you'll see like a little spot on each one. Those are actually acupuncture points, but we could also do acupressure on them. So if you press in on these areas or do like a little massage with your thumb on each of these areas, you will have an effect like acupuncture. Acupuncture, of course, those of you who've had it, use very fine needles to stimulate these points. One-use needles, I always say, we just use the needles once, very clean, sterile. But in acupressure, you would massage these areas. Now, these 2 points in particular, LI4 and liver 3. I'm not going to explain, how they get their names, but they're basically on the first one is, I may as well, on the large intestine channels, the 4th point. There are channels that run through the body that deliver the chi. Okay, they flow like rivers. You might have heard me talk about this before. And the other point is liver 3, which is the 3rd point on the liver channel. Okay, just a little background there. But these 2 points, I chose these because they're very general points for moving chi and blood. If you go back to the last slide, you say that, I had said that the main pattern for, treating PMS or dysmenorrhea is chi and blood stagnation, specifically liver chi and blood stagnation. So we want to move that stagnation, and these 2 points, which are known as the 4 gates, it's just a name for them. I'll talk about that in a moment. Move chi and blood very well. The gates are the wrists, the elbows, the knees, and the ankles, basically. And I believe that this is a little bit of folklore, but I was taught that there was a story saying, like, the reason they're called the 4 gates or the gates is because the joints kind of move like a hinge back and forth, okay? So we want to open the 4 gates so the chi can flow. The first point here, large intestine 4. You can press into that. I can't see myself, but I'm going to kind of show you if I take my thumb. And if you go into the webbing between your thumb and index finger, and you move along the length of the index finger, you get to your knuckle, you go a little bit further. That's the metacarpal of the index finger, okay? So it's in the webbing, but it's closer to the bone that extends from the index finger to the wrist. I don't know if that helps, but it's about halfway. You can see in the picture, or if I show you here, pardon my bandage on my thumb, my finger, you can press in there and just massage. We always refer to this point as the headache point also. I do it in so many treatments. It's almost, if I don't do this point, it's almost like something's missing because it's such a powerful point in so many ways. But it does move chi and blood.
Vicky, quick question, if you don't want me interrupting.
Sure.
So we do have a question of, and I've had this question from other patients of mine. How long do you do the acupressure for, and how many times a day?
Very good question, and I'm so glad you asked me because sometimes I forget because I'm so used to doing this that I forget that other people might not know. So thank you very much. Very good question. I usually recommend for a minute. When I do acupressure, I do each point for a minute, and the points are done, in this case, on both hands. They're done what we call bilaterally, so they're done on the left side and the right side. If they are on a limb, let's say it that way, okay? So about a minute is a good amount of time, okay? And not too much pressure, just like you're massaging into the area. You could use your own judgment. You want to give a good amount of pressure. And I like to do circles, like a circular motion, or you could just press in and massage, but you're basically massaging into the point. Do you think that was clear, Pina, what I said about the timing?
Yeah, I definitely agree. I usually, it's just about, you don't want to bruise yourself. You don't want to press too hard. It's really just a gentle pressure. And then, you just, usually what I do is like a little bit of a circular motion and, using the pressure. And then again, you do both sides, and absolutely 2 to 3 times a day you can do it, because again, obviously this is even though it's not as strong as needling, it's, you can do it more frequently.
Absolutely. And you can take this treatment, you can do this every day with acupuncture.
Right. And can you guys see my hand here? So I don't know. I know you can't see Vicky because she's got her screen up, but if you look at my hand, it's like, if you see where the highest point is, where if you're putting your hand in, that's where large intestine 4 is. So when I massage it, I'm just doing a gentle massage that way. And even if this were my feet, so let's say these were my toes, and this is between the first 2 toes, and forget my thumb for a minute. Let's say these are my toes and I had another toe here. It's right in between that joint, because this is a more real sensation, what you would feel on the feet in between here. So again, you kind of want to feel in between the bones. So you're not just touching the top of your skin, you're going a touch deeper, and the same here. you're going to be pressing inward.
Great. Thanks so much, Pina. I didn't realize that I wasn't on the screen. I know I can't see myself.
Although someone just said they can't see me, they could see you, Vicky.
Oh, okay.
I don't know.
All right.
All
Well,
right, you know what? Maybe at the end we'll go over it, just how to press again. But let's just move on for the sake of time.
okay, sure. So you can see the point, liver 3 on the foot is very similar to, it's like in the same spot as where the hand is. It's between the big toe and the next toe, and this is between the thumb and the index finger. You know, like I said, the big toe and the second toe. And both these points are very good for moving chi and blood, which is usually the culprit with PMS and painful periods. Okay, so let's move on to another topic, whole other thing. PCOS, I mentioned, is polycystic ovary syndrome, and it's a hormonal disorder. And it's, for the most part, of unknown cause, although it tends to be more common with overweight women, and it's where fluid and follicles surround the ovaries and inhibit their functions, basically, like it says here. I've seen a few patients with this, and they've had other complications. Usually, I see them when there's a problem with fertility. They could also, have gestational diabetes. They tend to have acne is another complaint, or they tend to have hirsutism, which is, they have, hair on their arms more so, or even on their legs, body hair more so than most women have. So there's a lot of different signs and symptoms with this. And usually their periods are longer, so they have less periods per year, let's say, maybe only about 9 or 10 periods, would you say, Pina?
Yeah, I mean, it does vary. I mean, the whole idea is it's a prolonged, lengthened time in between your menstrual cycles, or even with some women, they don't even get their period at all either. So we really can go any which way with this. With polycystic ovarian syndrome, part of the causes are, again, you can go down a testosterone road where your ovaries are producing too much testosterone, and you get these things like what Vicky was saying, acne or increased hair growth. Or the other road is this insulin resistant way, and you see more of this metabolic syndrome where you have the abdominal weight gain, maybe a thinner leg. But again, either way, women would have an irregular menses and also can have a lot of difficulty with regards to conception, because ovulation doesn't occur very well. It doesn't occur in a timely manner, I should say. And also the ovulation itself is not, as effective. Sorry about that.
Yeah, and I was going to say when the period's effective, and either not having a period or a long period of time between the periods, heavy periods, whatever, there's usually, it's almost, how can I say this? There could be problems with fertility, and we see that often with PCOS. And that's why the first thing to do is to treat the initial cause or the underlying cause of PCOS, and also regulate the period, especially if the woman wants to get pregnant. Now, I had mentioned that many times women are overweight with this condition, or can lead to gaining weight. And one of the common patterns I see with women who have PCOS is dampness or phlegm. Dampness in the body, it's almost like extra water or phlegm. You can think of phlegm like mucus in the chest, that thickness of fluid. But it could also, manifest in different ways. In this case, it's affecting the ovaries. It said follicles and fluids that build up around the ovaries that cause this condition. So when there's dampness and phlegm, first thing you want to do is eliminate dairy. I would say it's not the simplest, but it's key. And go on an anti-inflammatory diet, which I would say avoid nightshades. And for those of you that don't know what nightshades are, the main ones are tomatoes, white potato, peppers, and eggplant. I guess cayenne pepper would fall into that too. And Pina has an excellent anti-inflammatory diet, whole program that I don't know if you could highlight a few of those
Yeah, I mean, pretty
aspects of
much
it.
like you said, I mean, usually, when it comes to treating PCOS, you want to do, like you said, anti-inflammatory, avoiding nightshades, gluten, dairy free. I'm a huge fan of blood type diet.
Mhm.
Dr. Diadamo, who wrote the book, was one of my professors. And I thought, okay, when I graduated medical school, if, it seemed a little weird that if it didn't work, I would just toss it. But 16 years later in my practice, it is the same diet program. And I say diet, it's not, just for weight loss, but food program that I highly recommend, because when you're eating foods that create something called lectins, that's what triggers this inflammation in our system. So knowing, avoiding those foods that trigger that will absolutely decrease the inflammation. And then along again, knowing with PCOS, if you're having more of a testosterone issue or an insulin type PCOS, then again, you can further, break it down and fine tune your diet with regards to foods that can lower testosterone, like, for example, like nettles or nettle tea, or pumpkin seeds, or if you have more of the insulin resistance type, what you could do with regards to, let's say, low glycemic load fruits and things like that. So, learning your nuances within the PCOS will be very helpful when it comes to treatment. And then, one thing I also didn't want to forget in here is a lot of times with people with PCOS do have a lot of environmental burden in their system and a lot of toxicities. So it's also good to look into that component as well.
One thing I wanted to ask you about the toxicities and even the estrogens, and just let me know if this is correct. When a woman is overweight, obese, the toxins and the estrogens, they tend to be stored in the fat cells. Is that true?
Yes.
Okay. I just wanted to make sure before I said something like that. So, it's kind of like the give and take. If you're overweight, you're going to be prone to storing more toxins, estrogens, which will affect the hormones, and your overall health. And so that's why I put here it's important to exercise. Exercise is good for everything, moderate exercise, and maintain a healthy weight. With acupuncture, the key with dampness and phlegm, if that's the pattern that we're treating, which commonly is with PCOS, like I said, we would want to drain dampness, transform the phlegm so it could move out of the body. And we would use points that do that. I'm going to show a point in a moment, which would be an acupressure point also. And there are Chinese herbs that can drain dampness, such as poria, which is fuling is the Chinese name, and that's in a lot of formulas. Also, some foods, bitter foods tend to drain dampness too. Foods such as celery are bitter. And I'm trying to think of another, arugula are very good. And also barley tends to drain dampness by strengthening the digestive function. We'll leave it at that, okay? It's spleen and stomach function, which is associated with digestion, of course. Pina, you already mentioned some naturopathic remedies. Is there anything you want to add before I show one of the points for
No, I mean, I guess with the PCOS, again, like I said, it's really depending on, that's why I love acupuncture, because, it just works even despite what you do, and that's with so many aspects about acupuncture and acupressure. It's so great. But, other remedies, again, it's more specific with regards to, what type of PCOS. Again, there's so many herbs that can support, like, if, again, a woman's going to have ovarian cysts, there's things like inositol that helps diminish those cysts, again, cleaning out the body using castor oil packs to help the lymphatics clean out a lot of that phlegm and the damp from Chinese medicine. I also, again, using the different botanicals, to treat whether a form, because when you treat PCOS, and most conventional doctors, they'll put, women on the pill, and, which will give them a regular period, but it really, again, doesn't treat the underlying causes or imbalance. And that goes whether even a lot of women go on the pill for dysmenorrhea or just PMS. And so I really just don't think that's a solution, because especially when you're dealing with a young woman who gets put on the pills, early on, doctors don't have an exit strategy, and they're like, oh, it's totally safe and fine for you to be on the pill forever. But it's really not, because when it does make the body more yeasty. It does deplete B vitamins in our body. And when a woman, let's say, does want to have kids, it's a lot more challenging, because you haven't trained the pituitary of like, oh, this is what we're supposed to be doing. But again, I think with PCOS, rather it being like this broad, either women get put on metformin, or they get put on the pill. It's, again, if you can really hone out, do I have more testosterone driven PCOS? Do I have more insulin? And that's simple blood tests, very easy blood tests that your doctor can do. Do a full testosterone panel along with an insulin test, along with the blood sugar, and your body will show you what's going on.
Yeah, metformin, that's for diabetes.
Usually it can be, but they give it a lot for PCOS.
Yes, which, and I believe commonly it's diabetes is commonly associated, or women who have PCOS have a proclivity for diabetes, I believe, from what I've experienced and seen with people. I just wanted to make a comment about the blood type diets that Pina mentioned. I really like the blood type diets, first and foremost, because it's a test. You do a blood test. It's not where you have to, answer all these questions about, what foods you like or your athletic ability. And, we tend to fudge those things, I hate to say. Okay. But you're usually, A positive, O negative, AB, B positive, and then you can follow the recommendations from there. I kind of like it because it takes, all the, I don't know, fudging and foolery out of it, is the best way I could put it. So if anybody's interested in the blood type diets, there's good information online. We have books. Pina is very well versed in all of them also. Okay, so I had mentioned there's an acupressure point or an acupuncture point that we could use. Actually, it's an acupuncture point. We're going to do some acupressure. And this is spleen 9. This is good for draining dampness. And this can drain dampness for, in a variety of conditions, not just for PCOS, but if there's just, phlegm in the body of any type, if there's edema in the legs, if there's even a fogginess in the head, which could be due to dampness. We could use this point. It's spleen 9. It's the 9th point on the spleen channel. And I tried to make this simple for people to find. This picture isn't that great, but what it is you go to the inner leg just below the knee. I'm not going to bring my leg up on the screen.
Can you guys see me? I will.
Yeah, okay. Go for it. Good. Okay. There's a former gymnast. There we go.
That's right.
So you see her inner leg, okay, the lower leg, the calf, and you have her knee. You go below the knee, and if you feel around, you'll probably.
I didn't shave my legs, but we're in quarantine, everyone. So.
And you can probably feel on many women, especially, it'll probably be tender. I can feel it myself, and that's a very good point to massage with your thumb, press in a little bit, do some circles, and that's good for draining dampness, and you can do that for about a minute on both sides, right and left side, okay? One thing I want to mention, I chose this point not only because it's a good point for draining dampness, but also the whole inside of the calf, the inner part of the calf is very good, is associated, I should say, with gynecology. Okay, a lot of people don't know that. I read this many years ago. There's a lot of good acupressure and acupuncture points that are inside the calf area, the lower leg. Okay, so that's just the side bar note there. Okay, so you can even massage the inside, like just some nice simple circles or just some light massage on the inside of your leg, and you will be activating the gynecological area. Okay. Okay, infertility, I put this here because it's so common, unfortunately, and it can be caused by many different things, but it is the inability to conceive after 1 year of trying. And like I said, many causes. It can even be related to the male partner. Okay, I have a woman that I went to acupuncture school for my doctorate program. She lives in Nashville, and she specializes in women's health for the most part. And she had mentioned once that when she treats infertility, she always tries to get the husband or male partner in for sessions also. Because even if they say, oh, my sperm count is fine, the motility is fine, it might just be his general health. It's always good to treat both partners if you can when it comes to infertility. And she said she gets much better results when she treats both partners. So I just wanted to throw that out for anybody who's interested in acupuncture, to also discuss things, with their husband or partner, even beyond just the Western testing, if those are all negative. Other causes, like we had mentioned, PCOS, endometriosis, I had touched upon, and of course, hormone levels. Pina has already discussed a lot about the naturopathic remedies. If you want to add something before I talk about the acupuncture TCM, as far as that, I mean, it's basically, you have to look at the whole picture, just like with acupuncture. There could be so many different things going on. It could be stress. I mean, how many times have we heard of women saying, we're thinking about adopting. Once they decide to adopt, she becomes pregnant. I've seen this, in real life situations, even before I was a practitioner. As a young person, I was renting a room in someone's home, and the next thing, she was pregnant after they were making plans to adopt. It happens often once the the stress is off of trying to get pregnant. That's just one example. Pina, you were going to say something? I'm sorry.
No, just really quickly. I mean, you're 100% right. I mean, most women think that infertility is a women's problem, but it's actually 60-40. It's more on the women's side, 60%? Yes, but that's almost 50-50. So definitely getting your partner involved, to optimize, sperm and their health, because one of the big things I just wanted to mention before you move on, because, I think we can do a separate lecture just alone on infertility, because all of these subjects are so big within themselves. And I know we're kind of brushing them along, but we just wanted to do an introductory webinar. But when it comes to conception, one of the things I love talking about is the field of epigenetics, and that, epigenetics is what occurs above the genes and what turns on good and bad genes. And what most people don't realize, that the healthier you and your partner is prior to conception, you could actually stave off chronic disease in your children. So just to think that the healthier you get yourself in, the healthier your partner's in, when that egg and sperm come together and it's in its best place possible, you will actually can stop chronic disease in your offspring. Like, how incredible is that? So I just wanted to reinforce that aspect, that, optimizing your health is not only obviously with the end goal of conception, but really an even further goal of, ultimate health in your kid.
Absolutely. You just sparked an idea in my head, because a big part of fertility is having what we call essence, or Jing. The Chinese term is Jing, Jing, and that refers to the energy that you receive from both of your parents at birth. Okay, and it's something that you carry with you. It gives you your underlying vitality through life, and as you age, it tapers off. But the point I wanted to make is, if you're looking to have children, like Pina said, it's, your health and your husband's health or your partner's health are important to give that essence to your child that they will use throughout their life. So it's even in Chinese medicine, it makes sense. It gives them a good starting point. And so it's not just about conceiving and going through the pregnancy, but also setting up your children for for health throughout their life. And usually infertility, or fertility, I should say, is related to the kidney, the energy of the kidney. And it could be kidney yang, which is the active and more the warming type of chi. The yin, which is the more nurturing and solid and cooling type of chi. Okay, I'm throwing some terms out there. It'll make sense hopefully in a moment when I talk about menopause. And also, it's also related to the quality of the blood. Okay, which has to do with the menses. And also liver qi stagnation. And what I'm talking about now are all Chinese patterns. Sometimes it's a little challenging for me to explain things in Western terms, but basically, you want to have good energy, the yang energy, which is active, but you also want to have a nurturing aspect too. And you want to balance. We always want to balance and harmonize yin and yang. And then if things like if there's, let's say, too much testosterone in a woman, she might not be able to conceive because she has, what we would say, probably more on the yang side. Okay, if the blood is what we'll call deficient, where the quality of the blood isn't very good, or there's not enough blood, usually you see that in a scanty type of period. We want to build the blood, and we could use herbs for that. Of course, acupuncture and acupressure, and also certain foods are good for building blood. Things like beets come to mind, and green leafy vegetables. We talked about liver qi stagnation, stress. Mention that. If a couple's very stressed, it's going to be that much harder to become pregnant. And also, when you relieve that stress, by different methods, either, through meditation, yoga, seeing a naturopath for certain botanicals and supplements, acupressure, just, relaxation, you're more likely to become pregnant. The first thing we do with TCM, which is traditional Chinese medicine, and acupuncture is part of that, is to regulate the period. Okay, if the period isn't present or very irregular, it's going to be that much harder to become pregnant, and we usually see this in infertility. So that's usually the first step. I'm going to jump to menopause before I show you some more points. Occurs around the age of 50. Plus or minus 5-10 years. It just seems to fluctuate between women, but the mean age is around 50, early 50s or so, and that would be the period stops. You're not only able to no longer able to conceive, and unfortunately, like I mentioned way back when we started this, there's a lot of mood changes, hot flashes, a lot of symptoms that are present. There's a whole list here. And when I was in school, I was in a gynecology clinic, and I raised my hand and I said to the teacher, we're so, we know all the things that can go wrong with menopause, or the things that happen during menopause that aren't pleasant, the decreased libido, memory loss, weight gain, the insomnia, night sweats, all these things that are listed here. Is this supposed to be the way it is? Is this with every woman? And he said, not really. It shouldn't be severe. You shouldn't have symptoms of this nature. But if you had a difficult period or painful period or irregular period with mood swings or irritability, you're more likely to have symptoms of this nature in menopause. So, not that I want to set anybody up for like, oh, I'm going to have a terrible menopause, but I just wanted to throw that out there because I thought it was an interesting question and an interesting response that makes sense, actually. If you had problems with hormones, or very stressed and have that stagnation, when you look at the Chinese medicine side, you're probably going to, if you don't do anything about it, make changes, you're probably going to have problems later on in life too, of this nature. Okay. Does that make sense to you, Pina? I hope I explained that.
Yeah, I mean, the reason why you're saying that, I mean, the whole idea, what Vicky's trying to say, if you haven't fixed your hormonal problems before you went through menopause, like if you had PCOS or PMS or any of those hormonal fluctuations, they're going to be carried through into menopause. Because the big thing, what I wanted to address here as, as an end point, but really overrides all the hormonal imbalances, is really about like liver metabolism of your hormones. And this is why things get carried through, because like, you know, Vicky was approaching this from a Chinese medicine standpoint in terms of liver qi stagnation and whatnot. But really, you know, it's how does your liver detoxify these hormones? Because that is the organ that does it. You know, so if your liver is congested or you have methylation issues, you know, your body's going to be clogged up, if you will, and you're going to get these imbalances. So when women have this, let's say, inherent liver congestion, and now you're compounding, you know, stress on top of that because you have kids or you have a busy career, or, you know, it's hard to manage everything and you're not exercising, all that stuff will accumulate and the hormonal excess will accumulate in the liver. And this is why you would see the hot flashes or the insomnia, and things of the sort. So, you know, so a lot of times people will focus on, you know, well, what botanicals would be enough to help me put me back into balance, which is, yes, the herbs do help, but you really do need to look at yourself in a holistic standpoint again. Is, you know, are you taking care of your liver? Is, you know, you're eating liver foods? Are you exercising? Again, doing castor oil packs, you know, again, watching stress management. You know, I love the idea of menopause because from a Native American standpoint, you know, women were most honored when they went through menopause because it's truly from their philosophy when a woman comes into her most wisdom. And so she really comes into herself and who she is and really can share that wisdom. So it's a beautiful time to also learn about meditation, about really what is these next 50 years in my life going to be for myself? How do I want to live, and how do I want to impart my wisdom? So again, using, you know, thinking of it from a more global standpoint, you know, with the liver, and then all these other symptomologies usually diminish. Like when you're working with, let's say, low libido or weight gain and things like that, like those things you can tweak through the botanicals and through nutrition. But I think overall, you know, you also want to see yourself in this really place of wisdom if you can.
That's, you know what, that's great. Good things to look forward to also, you know, place of wisdom, looking at that, you know, looking at that in that way. Yeah, also, yeah, that was very good with the liver. It's so true because the liver, if it's congested or, you know, toxic, you're going to have other problems, even allergies. A lot of times when we treat for allergies, it's not just about, you know, the nasal passages or, you know, the inflammation, but also, you know, cleansing the liver so the liver can, you know, its function of metabolizing the toxins that we bring in on a regular basis and clearing them out. I wanted to mention with menopause, being an acupuncturist and Chinese medicine practitioner, I can't talk about menopause without talking about the chief pattern that we see, which is like the underlying cause for these hot flashes, especially in night sweats, and it's called yin deficiency. And I put heat in the brackets here because you usually have heat signs such as hot flashes and night sweats. And when I say yin deficiency, what that means is there's not enough yin. And I mentioned earlier that yin is the cooling system of the body, or associated with the cooling of the body. Yang is more heat, the warming. Okay, that's just very simplistic. So you want them to be kind of in balance, you know, but if as we age, especially when women age, especially women being more yin for the most part, we tend to have less yin. Okay, we could say estrogen drops. That's what happens in menopause. So if the estrogen drops, suddenly we don't have that cooling and we feel the heat of the yang. Okay, kind of a simple way to put it. But we call it deficiency or yin deficiency because it's not because we have more yang or heat thrown on the fire. We actually have less of that cooling system and we feel the heat. Okay, so what we do as acupuncturists in Chinese medicine practitioners are we use herbs and points to nourish the yin and to clear the heat. Okay, so I'm trying to give you a little education of the background of what we do. It's very different than the West, although, you know, we go for the same results, of course. And you talked about some great naturopathic, you know, way to look at menopause and some remedies. Are there any other remedies that you could think of? I'm trying to think.
For menopause hot flashes and things?
You know, the dong quai, gosh, it's like I've got that memory loss here. What's the one I'm thinking of? There are some herbs and different botanicals that you can.
I mean, you're thinking of black cohosh for menopause?
Yes, that's the one.
Okay.
Thank you.
That's the big one. That's the big one.
That's the biggie. That's the one I was thinking. It's like, why can't I think of that? Okay. Okay. So there's different, you know, remedies that you can be that can be taken orally too. Okay. I put these 2 points here. Originally, I was going to put them in just for menopause and because they okay. And if you take your hand, I don't know if you can see me or and if you take your hand and you tuck your thumb in, the measurement between the 2 outer knuckles is what we want to use. I don't know if that's clear. And you can put your pinky on the inside of your, you can measure from your ankle, the high point of your ankle, which is that little bump on the inside of your ankle, okay, up. And where your index finger falls is where spleen 6 is. It might be tender on some people, but it's on the inside of the leg. You can see, I don't know, about like 2 or 3 inches up on most women. And it'll be a tender point, and that's very good for many things with gynecology. It's good for building blood. It's good for, you know, nourishing yin. Like we said, we need more yin as we age. It's good for, it's the point of all points for any gynecological condition is what I can say. Okay, it builds the blood, like I said, does many good things. All right, now one thing I wanted to mention, if anybody's interested in an acupressure, a customized acupressure session, I'm doing them right now. I've had very good results. I just heard from a patient who had an acupressure session with me a couple of weeks ago, and she's doing very well, and I was very happy to hear that. So I am offering that. If you want me to put a package of points together for you, I'll email you the pictures first, and we'll go through them, go through the whole treatment together, and I'll explain things to you and also make other recommendations, okay? And there'll be a slide at the end where you can, you know, contact us if you want to set something up, you know, set an acupressure session up with me. I'd be very happy to work with you individually. Kidney 3 is another point, very good. Now this is a good point for infertility also. I use this point often, and if you find the high point of the inside of your ankle, so if you look at the inside of your leg and you look at your ankle, the inner part of your ankle, and you'll see that the bump of the ankle there, and you just roll off towards your Achilles tendon, and there's a space there, that's where kidney 3 is, okay? And you can massage into that area, and that's very good for especially the yin, okay? And tonification is also a good point for lower back pain too, and knee pain. I'll just throw that out there, okay? This is the reference for all the pictures you saw. I took them from a book called Manual of Acupuncture, and I did want to give them credit. I think that's pretty much it today. Did you want to, let's see, why don't we take some questions, Pina, unless there's something else you want to add?
No, I mean, definitely we can answer more questions about menopause. I know we've been a little bit over an hour here, so I don't want to take too much of everyone's time today. But if you want to ask 1 or 2 more questions, we're happy to do that. You know, before you have any questions coming in, I want to ask, just thank Dr. Vicky again. She really is an amazing practitioner, just a wealth of knowledge with regards to all aspects of human health in our body, whether it's, you know, obviously from so many different conditions, she knows how to treat. And I know I had, like I said, referred a bunch of my patients in quarantine for these acupressure sessions, and they really have noticed a huge difference. So it's a, you know, a real testament not only to the effectiveness of even just what acupressure does, but also obviously Dr. Vicky's skill set. So I wanted to personally thank Vicky just for being extraordinary, and I'm just so honored to work with her. And so let me see, we have another question here, a big question of if you could not talk too much about this, but are there any other ways that someone can nourish their yin, which is really important? We all can use that.
You know, there are some foods that they say nourish you. And the one that comes to mind is clams. Um, Although I don't have any anecdotal, you know, testimonials about it, but that comes to mind. And there are botanicals and herbal formulas that will. Though I would suggest making an appointment with, if you're interested, with Pina or I, and we can guide you in that direction. And also, the points that I showed, let me see if I could go back. I'm kind of stuck here.
That's okay, but really just those kidney points at the bottom, and then really just having foods that are warm and cooked is very, just general, like, because a lot of people will eat a lot of cold raw foods, and that's very damaging to our yin. So just eating just warm cooked foods, soups and stews, all of that will be like warm Epsom salt baths is nourishing. So there's a lot of different ways to nourish your yin, you know, especially as we get older. So, you know, there's, you know, besides the acupressure points, there's a lot of things that we can, you know, do that way. It's very simple to keep that essence up. Someone asked,
meditation too.
Yeah.
Meditation. Is there a question?
Yeah. So a quick answer to that one is milk thistle good to take during menopause? Absolutely. You know, what I was mentioning before when it comes to menopause and liver health, milk thistle to help is a great botanical. Taraxacum, which is also dandelion, is a great liver herb. Artichokes, beets, those are all beautiful things that you can eat or take to help the liver strengthen and detoxify. Vicki, another question is there anything you can say about chronic headaches? Could that be hormonal imbalance? Since childbirth, they have been frequent and bad. Oh, I'm sorry to hear that. But do you want to answer that, or I can?
As far as, you know, a lot of times there can be what we call a blood deficiency. This is Chinese medicine talk, where you're not getting, for lack of a term, the circulation or the qi to the head to nourish, you know, the brain. There could be a lot of different reasons. As far as hormonal reasons, I'm not familiar though. Pina, do you?
Oh yeah, the short answer is yes. Definitely, you know, headaches can be a complete hormonal balance. Even when I'm treating people with chronic migraines, hormones are a huge, huge piece of that. For women in particular, because, you know, if you're treating headaches without treating hormones, then you're completely missing the boat. You know, and definitely during childbirth, whether it is that hormonal fluctuation that maybe you're just depleted in progesterone again, or that, you know, you don't have enough blood. You know, sometimes again with pregnancy, with delivery, you lose a lot of blood and you don't actually regain that for some women. So there are a lot of issues with regards to chronic headaches and it being hormonal. So the short answer, it can be with that. And the other thing I also want to mention is, you know, also not only just working on the liver through menopause, but also working on the adrenal glands, because if you're not, and which is also part of your yin, if you're not strengthening the adrenal glands, like with herbs like ashwagandha, or again, exercise and meditation, and menopauses will also be harder in terms of its transition. So also looking at the adrenal glands. Quick question, do you do acupressure on both legs? Yes. And one more last question, and then we'll say goodbye. Is she's hearing so much about anxiety from her patients, sometimes interfering with milk reflexes. We have Donna Kimmick, who's an amazing lactation consultant. Hi, Donna. I love that you're on. She's had good luck experience with oxytocin sprays. Any other ideas? Oh, so with regards to anxiety, I think is the question.
Yeah,
Hold on, Donna. I have to reread your question. Sorry.
Yeah,
I
I
mean,
didn't see that
anxiety and
question.
hormonal balance is very, very real. Like women will get panic attacks or feel more anxious as their bodies will fluctuate their hormones. So that's also no joke. So again, you want to look at stress. Do they have a depletion of progesterone? Is the estrogen too high? Looking at, and again, lifestyle stuff like sleep. Are they exercising? Are they eating good foods? Definitely, like I'm saying, with stress, cortisol, like you're mentioning here, will interfere with milk letdown. Um, so, when you're working on those aspects, in totality, I think women, you can get anxiety under control with getting your hormones in balance. So that definitely would be the short answer. Okay. I think we need to call it because otherwise I think,
It's
like I said, we've had a lot of people writing in, Vicky, while you were talking about,
okay.
all of these topics are so big.
Yes.
And you're right. And I know we are just doing the surface over these, where each one needs its own hour to do its true justice. But, as a start of just talking about women's health during this time and paying attention to yourself during this time of quarantine is super important. But we are going to be posting these webinars on Inner Source Health does have a YouTube page, so feel free to look at any of our past webinars there. You can definitely go to innersourcehealth.com for other information, Facebook, Twitter, Instagram. Dr. Vicky has her own page, as do I, as does Inner Source. This week we are offering a 50% discount. We're doing a quick flash sale. So if you want to take advantage of Dr. Vicky's services right now, would be so great to take advantage of during this week. And
that'll be for all conditions, any condition.
Any condition, right. So Dr. Vicky, thank you so much. I just want to wish everyone good health, continued blessings, and please stay tuned for our next webinar.
Thank you. And thank you, Pina, and everyone. Stay well.
All right, you too. Take care, everyone. Bye-bye.
Bye.